Okay, so we're recording.
¿En español o en inglés?
Okay,
¿Español o en inglés?
we'll do English. Okay. My dad trained in internal medicine in the Bronx. Okay. In Bronx Lebanon Hospital. Great. All right, we're going live. And we are live. Hello, Reveal the Root Cause community. Thank you for being here with me and my dad. There's so much going on in the world right now and so many dense energies and just, a lot happening. Everybody's experience is really different. And so my intention for this 30 days of Miraculous Comeback Stories is to really build bridges and increase capacity for peace and compassion and knowledge. Yes, and so there will be an actionable nugget of wisdom to support you in moving toward that state of freedom, connection, and grace. And today's guest is my dad, Dr. Francisco Bautista Mena, aka Dr. Fico. And he's trained in internal medicine and gastroenterology, and he's presently finishing a fellowship in functional and integrative medicine in Boca Raton, Florida. And he was really a catalyst for change in my healing journey. So welcome, Daddy. And thank you for being here. And, tell us a little bit about yourself. And also, if you even what is functional medicine? What is integrative medicine? We can start there.
Well, I have to say that I'm particularly happy today because number one is the birthday of my first sibling in my life.
Son, yeah.
Alejandro Bautista Carlo, who is today 38 years young. And because this is my very first work with my daughter, Laura, in really the most exciting medicine available in earth right now. Mm. One is functional medicine. What is integrative medicine? Functional medicine is that discipline that is very personalized. Instead of going to try to, let's say, cure a symptom, instead, functional medicine goes for the root causes of diseases. We're gonna talk about that. And on the other hand, integrative medicine, as the name says, integrates the best of the Oriental medicine with the best of the Western medicine. And I'm very happy I'm, dealing with both of them.
Me too. We both are so passionate about helping people, and we have really different strengths that are super complementary. So I'm really excited to be having this conversation today. So let's get right into it. And why don't you give us a little bit of background as to why you took me up on this invitation, sharing miraculous comeback stories. Why is that meaningful to you?
In medicine, functional, integrative, conventional medicine, whatever the case is always essential to go back to the roots. I remember when I was about 16 years old that I get into college. At that age, I came back home with a headache. So my mom, Lucila Mena, who is Laura's grandmother, she told me, Fico, take this tea from a herb that she took from to college.
Sorry, Ted.
At that age. Echo.
Let me turn that off. Yeah. Okay, go ahead.
She took that herb from her backyard and made the tea for me, and I got better. And another day I had a very bad, earache, and she did some oil from a plant, also from her backyard, and I got better. So time goes by, and I got another illness, and she gave me another natural stuff. And I say, Mom, now I am dealing with prescriptions. So I thought, I didn't tell her, but I thought she was crazy, giving me another, natural stuff. But the truth is that now I am understanding that my mom was right. And why she was right? Because she was trying to deal with the root causes of most of chronic diseases. Those three root causes are inflammation, but not the acute inflammation, because acute inflammation is a good phenomenon. We're talking about chronic inflammation, in which many of the white blood cells, many of the natural chemicals that develop in inflammation, like interleukins, for example, cytokines, they take a very important role in the chronicity of disease. So the number one is inflammation. The number two is oxidative stress, oxidation. We really are like a piece of metal that we forget in the backyard and get rusted. We get oxidized. And number three, the damage in the immune system, in which many, many people develop, like myself, like my daughter, develop an autoimmune phenomenon. So inflammation, oxidation, and immune phenomenon are the main three root causes of diseases in the human being.
Wow. I love the combination there, Papi, of the story of Mama Lucila and, the herbs that she showed and like how that happened to you very early in life. And that's just really cool. And now how you integrate that into your work after years and years and years of practice and study. And I mean, my love of research probably comes from you. I mean, that's all I do nowadays, but cool. Okay. So give us, sure. Those were a couple of stories. Do you have anything else that you want to share about comebacks and yeah, and stuff that people believe is impossible for them? That's the important thing. Like, I think that people, that belief that, oh, this is my life now, I'm going to stay this way. Like that belief is the most toxic, I think, root cause that exists. So tell us a little bit of some really cool stuff that you've seen, heard, know about.
That reminds me, you see, in conventional medicine, we many times do, a battery of tests. We do a complete blood count, we do chemical, we do thyroid, we do urine, we do a lot of tests. And when they come back to us and the patient returns to follow up, we tell that patient, listen, all the tests came back normal, but the patient is having pain, the patient is having dizziness, the patient is having a fog brain, and the patient is having an array of symptoms. So I can illustrate you with a nice case that one of my colleagues, Dr. Lepine, who is an expert in functional medicine, had some time ago. This was a 35-year-old female who came to the office with history of numbness in her feet, both feet. On workup, she was found to have some abnormalities in the liquid that they take from the back of the patient for a lumbar puncture. So they made the diagnosis of multiple sclerosis. That was his patient, right? This patient had infertility together with it. Got some level of mercury found in the blood. She was sensitive to gluten, right?
Wow.
She was sensitive to that. And finally, she was found to have dysbiosis. Dysbiosis is a term that we use in functional and integrative medicine and in general medicine to say that there is something wrong with the microbiome of the patient. Microbiome is a new term for an old thing that is called the intestinal flora. In the case of the intestine, because we have microbiome in the respiratory ways, urinary tract, on the skin, nowadays we have found a microbiome in the eye, which means that if you manipulate what is there, which are basically bacteria, not in the eye, but in the general, in the microbiome of the intestine, we mostly have viruses, bacteria, we also have parasites, and we have fungi. Now, if you try these things and modulate them and take care of the intestinal wall, that can cause miracles in medicine. So with Dr. Lepine's patient with multiple sclerosis, with mercury, with infertility, with gluten sensitivity, and with the problems in the microbiome, she had a change in her diet. Her microbiome was treated with probiotics, prebiotics, and symbiotics. So now we know that pro, pre, and syn, you have to take care of those things in any chronic disease, because that's a start of most of the diseases, the intestine. Given that, to clean the gut, and finally, she was put completely off gluten. Sometime after that, the result was that the MS went away totally, that she got a very nice side effect of this treatment, and that was that she got pregnant.
Yay!
She, the gluten sensitivity went away as the dysbiosis. So these bacterial and these overgrowth, they went away.
Wow.
So that was a very nice story.
Yeah, that's such a good story. Oh my God. And I can relate so much because so many of those things are like, were what I was dealing with, probably. We didn't test for all of those things, but I mean, they were obvious at the time, or now looking back, it's pretty obvious. It was very similar. So that's freaking awesome. Wow.
And that's one of the whys that sharing Miraculous comeback stories are meaningful to me, because
Daddy.
it's something that is practically inexplicable, which is extraordinary, which is impossible. In many, many of the medical books that I have read, turns possible with, with some people believe, like me, in divinity. Some people also believe in changing the microbiome. Some people believe in changing the diet. And I am in the three groups, basically. So when I see a patient with a very complex disease, the last thing that I do is giving up on this patient.
Yeah.
Because we have, a big armamentarium nowadays, different tests that we can do that in conventional medicine, I didn't do it. Now that I know I'm happening to do it, and we are seeing, good changes in this population that didn't have a hope in the past.
Wow.
So I got another story, and this is a personal story.
Do it.
Back in February this year, in which one of my 6 kids had influenza type B, one of Laura's brothers. That was Moises. He got influenza type B, the same like other 4 kids in his school. The 5 of them had in the last influenza type B, got tested. And for the 5 of them, the only one that didn't show up the virus in plasma in his blood was my son, because he was taking prebiotics, he was taking probiotics, and he was taking symbiotics. So I was sleeping with him the 3 days of his influenza. I purposely let him, cough in front of my nose and my eyes and my mouth for 3 days. I did not have influenza type B, okay? And I have hypertension, and I have heart condition. And these people like me are the ones that are more prone not only to develop the respiratory disease, but to die in a hospital. So Lucas didn't have the influenza, but my wife, Dana, we almost have to take her to the emergency room because she was not taking probiotics, prebiotics, and symbiotics. So
Dad, oh man, you probably won't let her live that down, but wow.
other people like Dr. Lepine, and I have seen my own in this. And if I tell you my story with the coronavirus, you won't believe it. But that one, I leave it for the next episode.
Cliffhanger. I love that. Wow, Dad. Thank you so much, man. Those are great stories. I mean, you know, that's what this is all about. It's about elevating, you know, you gave me chills when you said, you know, I will never give up. Like, I don't give up. I don't either, because like we were talking about right before we went live, we are investigators, you know, we have to investigate those root causes. So in the spirit of that, you know, what is one takeaway that the listeners can implement today? You feel like, I feel like you had something else to say, so feel free to say that too.
One takeaway multiplied by 5.
Okay, beautiful.
I'm going to tell you that in 1 minute. Yes. My best takeaway for today is go to Google and put there several things like what is a good anti-inflammatory diet? What are antioxidant foods? And take a look at what is the stinging nettle. So these 3 things, anti-inflammatory foods, antioxidant foods, and this last one, the stinging nettle. This is a supplement that controls the cytokine cascade. The cytokine cascade is the particular phenomenon that kills the patient, kill the patients with upper respiratory infections like influenza and the COVID-19. The stinging nettle, the one that comes from the leaf, not from the root, but from the leaf, controls cytokine cascade that kill the patients. So obviously this is not approved for the FDA. I mean, don't take this as an advice to treat COVID-19 with that because it's not approved by the FDA. And in no way I'm trying to tell you not to go to your primary care. So the best thing is to go to your primary care and find out what you should do for the COVID. But that's an advice. Also, you have to give a good maintenance of the microbiome. Please take a look at what a probiotic is, which is bacteria, bacteria, what a prebiotic is, which is the best food available for your intestinal bacteria, and find out what a symbiotic is, which is a combination of pro and pre, okay? Finally, take a look at CBD, find out more information about CBD from hemp or from cannabis. This CBD acts in the genes of the 3 root causes of diseases. It acts in the genes of inflammation, it acts on the gene of oxidative stress, and it acts also in the immune system of the patient. So that's my takeaway for today.
In case you need to recap those are all amazing. Come back, rewatch it, take some notes of that, you know, and I love the invitation to do your homework. You know, the reason go ahead.
The most important thing here is food.
Yes.
Because food is, it goes and give like a talk to the genes in every and one of your cells in your system. It's like a good talk between the 2. And this food, they have to be antioxidant food, anti-inflammatory foods, and why not organic food? Because organic food doesn't have pesticides. Okay. The other thing is, take a look at the singing nettle with the effect that the singing nettle has on the cytokine cascade. that is the cause of death in most of the patients with inflammatory diseases caused by respiratory virus like influenza and coronavirus.
Okay.
Remember, it's not approved by FDA. And finally, take a look at how you can take care of your microbiome, all these bacteria, viruses, fungi and parasites that we have in the intestinal microbiome. They are not our enemies. Like
That's so important. That's such an important point.
They're not our enemies. It depends on the circumstances. So what happens is if you lower the number of good bacteria, then there are some other bacteria that are not that good, that they increase in number and they behave bad, and then you get sick.
Yeah.
But not that they are bad. You have to keep it in the right proportion and in the right relationship to other good bacteria. And finally, take a look at the CBD from hemp or cannabis that acts in the 3 roots: in the genes related to inflammation, in the genes related to oxidation, and in the genes related to immune disorders.
Amazing, amazing. Yes, I have in my own personal healing journey visited all of those areas, and it all starts with your awareness of what's possible, and then exploring these avenues that people like me, people like my dad are kind of highlighting, because there are solutions out there. There are things available. And so my dad is actually one of my advisors for my personal program. If there's things going on with your microbiome, like I want you to know like where I'm getting my information from, and I want you to encourage to seek out functional medicine doctors like him as well for this type of information. And then you integrate, right? You take what resonates, you take what works for you. There's no one size fits all. So Daddy, thank you so much for being with us today. You'll probably see him again. He's like awesome to interview, and he's got a lot to say, and I hope you'll come back. I wish you a peaceful day. I hope you got some nuggets from this. Go ahead and rewatch if you want to take notes. I know there was a lot of really juicy stuff here, and we'll see you again. I'll be back tomorrow with another guest. So thank you. Have a good one. I'm going to